With the country having recorded 307 new coronavirus cases,
reporting in the time of COVID-19.
Asilimia 90 ya wafanyakazi.
As part of those providing essential services, journalists are facing more threats at this time. After the first case of coronavirus was confirmed in Kenya in mid-March 2020, the local media immediately latched onto the story. Journalists were in their element, informing and educating audiences on the new disease that was slowly bringing the world to a standstill.
We overexposed our journalists. There was massive crowding around COVID-19 briefings and other places, and that was risky.
Over time, a number found themselves as part of the statistics.
Are you all my persons?
At 6 a.m. on a Friday morning, Johnston Eddie, not his real name, a journalist working for one of Kenya's media organizations, is at the rooftop of his residence in Nairobi. A COVID-19 patient in recovery and a home-based care. Doctors have told him that physical exercise will boost his fight against the disease, which currently has no cure.
I received another call from my boss and he told me, are you okay? Are you good? Yes, I told him I'm good. When you're free, let me know because I can hear you. You are in a mat. Actually, I was coming from town. When I reached him in the house, I called him back. And he told me now the results came out and you tested positive. The only thing that is keeping me on is these exercises, drinking warm water, mixed with ginger, lemon, and garlic, and a bit of honey. Yes, those are my home remedies.
He is not sure where and how he contracted coronavirus.
As a journalist, I've been interacting with so many people, isn't it? You'll find me there holding my camera with my fellow cameramen, you see. And I even gone to some of the isolation centers, we've done interviews with this, and having wear the PPEs is not an assurance that you cannot get COVID.
Johnston is currently adhering to the government's protocol on prevention and management of COVID-19, hoping that his next test will turn out negative.
I'm feeling okay. No pain, imagine. No any symptoms. I'm not coughing. I'm not having the dry throat or sneezing or headache. Yeah, I'm just like that. And actually, I'll get back until the result turns negative. That I'm very sure that next time when I go there and I pray to God, I turn negative.
Winnie Kamau, a Kenyan freelance journalist, recounts how she was forced into isolation back in March, soon after arriving in the country from Sierra Leone.
When we arrived at the airport, you were given the yellow cards to fill in. So I filled out the form and was stamped in and got in.
At that time, Kenya had just reported the first case of infection, which incidentally was an imported case. Also, she was already experiencing flu-like symptoms.
After they did the test, the following day I got worse. So I was told to take antibiotics. So I took antibiotics and paracetamol. So I was like, okay, let me see, maybe it will now get better. But the chest pains were too much. I called 719 again. They told me they have to evacuate me.
Winnie was isolated at Mbagathi Hospital in Nairobi for 14 days, after which she tested negative.
They did another test and we stayed there for like 3 nights and 4 days. And doctors would come doing their rounds and they'll just check your temperature, they ask you how you're feeling. On the 4th day, then they gave us the results and told us we are done. As in we can now go home.
Having defeated COVID-19, she tells me, another battle awaited her: stigma.
I remember when I came back and my neighbor, I was just saying hi to my neighbor. You could see even the way they're, and the kids were curious to see who's this, and the way they're pushing their kids inside the house. For me, I'm still scared. I don't want to push my body. I can't, and I don't want to go out there so much. And in my interactions, I'm looking at things from a different perspective.
Brian Waihenya is also a Kenyan journalist based in Nakuru and living with disability. He narrates how movement restrictions have affected him and his work.
The challenge of financial constraints, and I think that is one of the most popular challenges that we face as people with disability. We don't have work, and we don't have the means by which we can take ourselves from point A to point B, because it needs money.
The experiences shared by Johnston, Winnie, and Brian are a representation of how this pandemic has directly impacted journalists as they go about their business.
At the end of the day, journalists are human beings. And like they always say, there's no story worth your life.
Watch social distance, wash your hands, sanitize your equipment, take it seriously.
According to data compiled by the Media Council of Kenya, about 50 Kenyan journalists have tested positive for coronavirus. Other than exposure to infection, the livelihoods of many journalists have been affected. More than 400 have lost their jobs, while thousands have taken pay cuts due to economic effects caused by the global health crisis.
Luckily, we haven't had extremely serious people. Many people have gotten admitted or quarantined. Most of the people so far we know have come out alive to go on with their lives. But if you, for example, a correspondent who is paid per article, if you are quarantined for 14 days, it means you are not working and you need food.
It is the responsibility of an employer to ensure that employee is safe and working in a safe environment. When employees actually are infected or get in contact with this virus, it means this happened while they are on line of duty.
No one can control the timing of a viral infection, but in a country like Kenya, they can control what people know about it through sharing information via different media outlets. Therefore important to protect journalists, the unsung heroes. Purity Museo, Channel 1 News, Nairobi.